Welcome! Today we're going to break down one of the most critical parts of the overseas registration exam, the Diagnosis and Treatment Planning Exercise, or DTP. Think of this as your step-by-step guide to really mastering this pretty complex assessment.
So, let's start with the big question, right? How in the world do you tackle a high-pressure, 54-minute clinical exam and actually come out on top? Well, that's exactly what we're here to do. We're going to map out the entire journey for you, from the moment you walk in to the very end.
54 minutes. That is it. That's all the time you get. It's one single, continuous session where, believe me, every single second counts. The pressure is definitely on, but if you have a clear strategy, it is totally manageable.
So what is the DTP, really? Well, at its core, it's a simulated clinical assessment. It's not just testing what you know from a textbook. It's about how you apply that knowledge in managing and caring for a patient. And it's all benchmarked against the General Dental Council's Preparing for Practice standards.
Okay, here's our game plan for today. We'll kick things off with the setup, then we'll walk through every single stage of the exam, from those first crucial 10 minutes with the patient all the way to presenting your final plan. And we'll wrap it all up by looking at exactly how you get graded.
Right. So before the clock even officially starts, you're going to be handed two key items. And these things are designed to help you succeed: a special clock and a color-coded folder. These are basically your main tools for navigating the whole session.
The first tool is this clock. And listen, it's not just any old clock. Its face is actually marked up with the 4 distinct phases of the exam. This thing is your visual guide to time management, and it shows you exactly where you should be at any given moment. Pretty clever, right? Your second tool is the folder. Now, inside, you're going to find these color-coded forms that guide you through everything. White for the patient info, blue for the history, orange for diagnosis, and green for the treatment plan. And here's the best part. These colors match the phases on the clock, creating this really simple visual system to keep you on track.
Okay, let's dive into the first real stage and see how this all builds. The clock starts and boom, you have exactly 10 minutes for your first interaction with the patient. This part is all about taking a great history and making excellent notes as you go.
This first 10-minute block is 100% dedicated to gathering information, and you have got to get this right because it sets the entire foundation for your diagnosis and the plan that you're about to build.
Notice how strict the roles are here. Your job is to talk to the patient, ask really good, structured questions, and write everything down on that blue form. But here's the key rule. You cannot physically examine them. The examiner, meanwhile, is just a silent observer, grading your performance.
So once those first 10 minutes are up, the patient and the examiner will actually leave the room, and now you enter this 11-minute solo phase. This is pure analysis, where you start connecting all the dots by yourself.
This next part is a critical 11-minute sprint. You're working completely alone now, and your job is to translate everything you heard in the patient's history into a concrete clinical pathway.
Your focus now shifts. It's time to pick up that set of orange forms in your folder. That color is your signal that you are officially in the investigation and provisional diagnosis stage.
The absolute key here is to be systematic. You'll examine the artifacts they give you, you'll write down a provisional diagnosis, you'll justify any radiographs you need, and you'll list all the other investigations. Seriously, following this workflow is the best way to use your 11 minutes.
All right, next up is the longest and honestly the most intensive part of the exam, the 23-minute treatment planning phase. This is where you bring every piece of information together to create one comprehensive plan.
So yeah, this is the biggest chunk of time you get, 23 whole minutes. Your task is to synthesize all the data you've gathered, from the patient's history to your investigation results, and turn it into a coherent and, really importantly, a justifiable treatment plan.
Now, using those green forms, you're going to show the depth of your clinical thinking. You're not just listing procedures here. You're outlining different options with their pros and cons, writing a formal radiographic report, and considering everything from clinical risks to the patient's personal wishes.
And here we are in the home stretch. The patient and examiner come back into the room, and you have 10 minutes. 10 minutes to communicate your findings and your plan to the patient, all to gain their valid consent.
This final 10-minute segment is where it all comes together. All of your hard work from the last 44 minutes, it culminates in this one crucial conversation with your patient. Your communication skills are absolutely crucial here. The whole goal is to get valid consent, which means you have to explain everything in simple, clear language. You have to avoid technical jargon at all costs.
They are testing your ability to be a clinician who can actually connect with and empower a patient.
So, you've made it through the 54 minutes. Phew! But how is it all marked? Let's break down the assessment criteria so you know exactly what the examiners are looking for.
Your performance gets broken down into 5 core areas, from that initial oral history all the way to your final oral presentation. And for each of these areas, the examiners use a 4-point grading scale: exceed standard, meet standard, below standard, or well below standard.
Now, the most important thing to remember is that you don't pass or fail individual sections. The official guidance is crystal clear. The marks from all 5 areas are combined to create one overall score. And that single score is what determines if you pass the entire exercise. So yeah, every single phase matters.
So there you have it, a complete breakdown of the 54-minute DTP exam. When you look at it this way, it's a structured, predictable process. The question now is, with the map in your hands, are you ready for the journey?